Going from left to right here and kind of how I have everything arranged. I'm going to start with first thing you do when you get in the room, aside from greeting and seating the patient. Bring them back, get your consent form filled out, your bib, glasses, get the patient dressed. Then take blood pressure. I like these cuffs, but the arm cuffs are also really nice, so I suggest using those as well. Now, as for the actual tray setup, I use instrument packs. Like, I pack all my instruments together. I don't like packing individual instruments and grabbing them because we do a lot of extractions, a lot of surgicals, a lot of surgery. So I kind of just jumble everything in the same pack. But this is what a regular extraction looks like at my office. So periosteal elevator, you got your 77R, it's the curved guy. You got your, I think this is the 3 millimeter luxator from, I think this is Norden. Yeah, you can kind of see it there, Norden. And then we got the big boss here, 5 millimeter. Your elevators might look a little different, but always should have a couple of elevators or luxators in your extraction kits. Periosteal, you got your surgical curette. This is, I think, a Miller. I'm not sure if this is, I think this is just the regular size. They do make smaller ones and bigger ones. Just the regular size. Mouth mirror. Now this kind of gets into what I was talking about with the surgicals. Most offices, or I'd say a lot of offices, don't really do a ton of extractions or a ton of surgicals, like general dentistry offices. But I do keep a bone file in my kits because we do a lot of them. But generally, this is something you'll see more so in oral surgery or surgical extractions. Same thing here. A 15 blade. You could keep this as a hold supply, as in, like, you don't open this, like, you keep it separate. I keep it in the kit because we do a lot of surgicals. You got some Adson forceps. These are really nice for suturing with 2 hands, like to hold the tissue or grasp it. They also make tissue forceps that are a bit longer. They're about the size of these, but they're straight and they have kind of beaks. Those are nice. This is just what we use in my office. And cotton pliers, you never know what you need to grab. You pull a tooth fragment or something out, or tiny little root tip, you got your cotton pliers. Or if you need to just grab stuff and you know, you don't want to go rooting around in a drawer with dirty gloves on, use this guy. Moving on to the table. So this is what my side usually looks like, and then I'll usually just set that on the doctor side. This is what my side generally looks like. So you got your topical. I like these longer Q-tips for topical. I don't have to bend my neck as much. These are really nice. And then a good tip with doing topical, always give the patient 2x2 to bite on, so they don't get it everywhere. This stuff, I don't know if any of you have tried it. It does not taste great. Another tip, a pro tip here, you take a 2x2, dry the area, and then apply your topical. And then with that same gauze, you fold it, have the patient bite down, and that'll kind of keep it where you wanted it to go. Then onto the numbing side of things. We've got some local anesthetic, so we got some lidocaine and some Septicaine with the epinephrine. You want a aspirating syringe. You can see there, aspirates. And then I like to just set up with both, just because sometimes your doctor will change their mind. They tell you they're not going to block, and then they end up needing to block. Now you got to remove your hands, your gloves rather, and it's a whole thing. So I just take them both out. If I don't use one, set it to the side, or you can set them both to the side, and then when you're ready to numb, you just take whatever you want. And yeah, these are super inexpensive too. I mean, I don't see the reason to not do it. It makes everything so much more convenient. Got a retractor. This can go on either side. Doesn't really matter whose side it goes on. Then we've got some stuff to suture. So you got your needle driver. For my new dental assistants out there, the way you tell a needle driver from a hemostat is the crosshatch pattern. So you see how there are divots going this way and the other way. That is a needle driver. So if you have one that just has the pattern going one way, that's how you know it's hemostat. Also, the beak is generally shorter. So that is the needle driver. Got some suture scissors, tissue scissors, whatever you want to call them, just for cutting suture. And then some extra gauze for when you're finished up with the procedure. You give it to the patient to bite down on. And then coming over here, you got your surgical suction. These are nice for you know, just regular extractions. They do make thinner tips. They also make the metal ones. This is just what we use at my office. I like these a lot because you can also put bends in them. So I usually bend my tips like this because I find I can manipulate the tip a little better, the direction that I'm suctioning in. So these are nice. Your saliva ejector. I really only use these for when we're numbing. And then some air and water tips. I usually just use one. For the sake of the video though, I have two out, so if you want to put one on your doctor's side, you can. This is really just for rinsing after you're numb. I do know some doctors that irrigate with these, which does make sense. Patients drink water afterwards that isn't filtered or anything. So not the end of the world, but I don't really do that. I mean, I just use the saline here. Saline, irrigate when you're all done. So that is pretty much everything. In terms of stuff that I keep open for every extraction, it could be periodontally involved tooth, doesn't matter. This is everything that is in my kit for an extraction. Now, as for hold supplies, well, let me do this before. I like to have cups out for teeth to go in. If we're taking multiple teeth out, I like a cup. Especially if you're a newer dental assistant, you got some butterfingers on you or some slippery fingers. You don't want to try grabbing a tooth that's slippery, covered in blood, with gloves that are covered in spit, and then you're going to go dropping teeth and stuff. So I like the cup. Nice. As for hold supplies, these are supplies that you don't really open until you need them. At least that's what we do here. So collar plug. If you know we got a lot of heme that we need to manage, or you know whatever the reason may be. 15 blade. If it's a surgical extraction, you need this open from the get-go. You need most of this stuff open. This is just a simple extraction setup though, it's a simple extraction video. But these are additional items you might need if an extraction goes from simple to surgical. And you don't want to have to go trying to deglove and open your drawer and, you know, do all this unnecessary stuff, right? You want to be prepared, you want to be efficient. So root tip pick, can never go wrong having one of these out during an extraction. Root tip forceps, these are the 301s. They do make some that are a little straighter for the maxilla, but this is what I like. And then last instrument here, surgical handpiece with a, see if we can see the burr, with a 5418 carbide burr. These are really nice for sectioning or troughing, whatever you need to do. You can even use this, I've seen doctors use this for tori removal, alveoplasty. It's kind of a do-it-all setup here. And then some suture. Generally, if it's just for an extraction, you'll probably go chromic, maybe plain gut, the yellow suture, or the blue, the silk. But usually chromic is the way to go after an extraction. So that's what I like to have out. It's kind of just a full view of the setup. I also have, I think this is a spade elevator. Yeah, spade elevator. A lot of doctors like these. These are really nice. A lot of oral surgeons too. These are really nice for elevating root tips, wisdom teeth, you know, whatever, really anything. These are really nice. So that is the whole setup. I know I kind of showed you guys some surgical stuff, and my kit has a lot of surgical stuff in it, but this is kind of my whole setup. Now, if you were to just do a simple extraction, 100% doctor said, simple extraction, we don't need, you know, all that other stuff, then you wouldn't really need these items. And I'll just kind of put everything on the tray that you would need for just a simple extraction. So for just a simple, straightforward extraction, you know you're not going to need to trough or sit or split or section or, you know, do any surgical techniques. Then this is kind of where you'd go. So elevators, periosteal, curette, mirror, Minnesota retractor, syringe, stuff to numb. You don't really need the Adsons, but it is good to have a cotton plier in there in your setup. And then it's never a bad idea to also have a basic just sitting on the counter in case they want to examine something, or, you know, whatever the case may be. And one more tip before, you know, I end the video here. Also, this setup, disclaimer real quick, I'm not using this setup on anybody. My office is closed today, so I'm not using this setup on anybody. This is just for demonstration purposes. I want to move this topical here. Another thing I like to do with my setups is I like to cover my instruments because they look pretty scary, and a lot of times patients will get even more nervous seeing all these instruments. So what I do is I will fold the tray cover here. Now you want to do this with gloves because you don't want to get your instruments, you don't want to touch your instruments with bare hands, but that's kind of what the patient sees instead of, you know, all these scary looking instruments. As for the stuff on the table here, you just take the patient bib, the bib you're going to give to your patient, and you can cover your instruments that way. And it looks a lot less intimidating. I don't recommend laying out all your stuff, like having everything open to where your patient can see, just because it is pretty scary, and the patient might kind of lose a little bit of confidence with, you know, the thought that it's going to be painless or whatever the case may be. So yeah, that is my setup video. If you guys want to share this to any new dental assistants or anybody at your office, you like the setup, you want to implement it, you know, whatever the case may be, please share the video, leave a like, subscribe. I do plan on making some more videos on setups, or, you know, dental assistant questions, or you know, product reviews, whatever we end up doing. So yeah, that'll be it, and I'll see you guys in the next one.